We're back for part 2 in our 3-part series with the Brain Collective. Today we're going to continue our discussion around this fascinating technology where the Brain Collective can measure people's brains and help them in the way that they think and feel. So let's get into part 2. Who is this treatment for? Who do you see that comes to your practice?
It's a good question, Angeline. We see people who are range from 3 years old to 103. And so we see a very wide spectrum of people, probably about 50% children and then 50% adults. We are contacted a lot about anxiety. I think out of the 12 inquiries we've had this week, 6 have been child anxiety. So, and we know from our local schools, it's becoming a massive problem. Children not able to get over the doorstep at school in the morning. So anxiety is definitely something that I think we're pretty effective at helping to train it out of someone. So anxiety, depression, we see OCD, which is very disruptive. We see ADHD, ADD, which is a slightly different scenario. And we see a lot of processing disorders as well, people who really struggle cognitively. And then we have the cognitive decline. Very successful with head injuries. So whether that's someone who's fallen off a bicycle, had a rugby injury, football injury, or had a traffic accident. So real big spread of people.
I think it can also be a lot of people have emotional trauma.
Yeah.
We often talk about the big T's and the little T's. There are people out there who've had big traumas, but we all have little traumas in our life, and they all add up. And, the more traumas that you have on early on are more impactful for you later on in life. So, essentially, although when we, on our website, in order for people to find us, we have to use these diagnostic categories. Actually, that is not important for us. We are very much working on an arousal model. So we're not interested whether or not somebody's got a specific diagnosis, or we're just working with somebody as peak performers to help them be the best that they can be. We approach it in exactly the same way, because everything we're doing is peak performance training, whether or not you're coming from a place of difficulty or not. And very much a lot of these diagnostic categories are actually associated with dysregulation in somebody's arousal system. So that ability to be in the optimal place during the day, a calm, relaxed, focused state to enable us to get on with our life. That's where we want to spend the majority of time. There are times when we will feel a bit stressed or anxious. That's normal. There are times when we'll feel a bit bored or disengaged. That's normal. We need to be able to calm down at night to go to sleep. But unfortunately, some people get stuck either at one end of the curve or the other, or they flip-flop around all over the place. They have a very unstable arousal nervous system. So diagnosis per se is not important. It says if somebody's having something that is symptomatically difficult in their lives, that is stopping them functioning effectively, then neurofeedback from a holistic, or neuromodulation, neurofeedback from a holistic perspective can help to better regulate that brain. So you don't need to have a specific diagnosis to come here. We see a lot of people who come, for example, big thing at the moment is people I've been diagnosed with ADHD. That's fine. That's a piece of information for us, and it may or may not correlate with what we see on the quantitative EEG, because it's not one thing. Again, it's not, we know that there are 11 different phenotypes for ADHD on an EEG, at least, probably more. So it's not diagnostically defined. That's how people find us.
Essentially, we are brain training to optimal health, Angeline. We're trying to get people in it. And I think the comment Melanie made about getting people into a good arousal state is really important. We see a lot of people who are sympathetically aroused a lot, so they can't go to sleep at night, they're waking in the middle of the night, they wake up anxious, they feel like they haven't been to bed, and they continue the rest of their day hijacked. Yeah. And what we're doing is we're taking the hijacker out on this one. We're trying to get people into a state where they can actually regulate their own emotions. Regulating your own emotions is just so important. And, it'd be great if we were taught how to do this at school.
Yeah, it's on the increase, isn't it? Anxiety, and it is debilitating. When you think about when our brain is in that state, we can't learn, we struggle to concentrate. So it's impacting our work, and that anxiety, it's a perceived, often a feeling of not being safe on a subconscious level. We might not be fully aware of that, but really it's kind of a constant feeling of being under threat in some way. Some people think they're going to lose their job, if they don't perform it to a perfection level. It can be quite subtle, can't it? When people think about anxiety, it is quite common. I think that there's lots of people who have daily worries where they feel under threat in some way. Like perfectionism is something that shows up, isn't it? Where people are trying to they worry that they're going to lose their job for that. That's just an example of that. So it's such a huge impact on everyday life, this stuff. So being able to regulate emotions, and like you say, it would be great if this could be taught in schools and part of the curriculum, a bit more on regulating emotions and how to manage anxious thoughts, or general worries, and just having a bit more of an open dialogue. I think the younger generation are getting better at that, about being able to express how they're really feeling. But yeah, coupled with the open dialogue alongside your work, it's going to have a powerful impact. So who is this treatment not for? Is there a group of people where this treatment really wouldn't be appropriate?
We're sometimes contacted by people with really unstable epilepsy, Angeline. A lot of our technology, a lot of the techniques that we use in neurofeedback actually come from stabilizing epilepsy. And it is a very useful technique to stabilize epilepsy, but we're very, very clear with people. People have to be as stable as possible on medication before we can help them. So people think that they can just bin their medication and that this will be the solution, and it isn't for epilepsy. Epilepsy is often best moderated on good medication, and then we're sort of the icing on the cake.
We're an adjunct.
Yeah. So we're very clear with people about that. We don't want to promise something we can't do.
And we're not neurologists and we don't diagnose epilepsy, but, we are familiar with what we're looking for on an EEG. And if we were to do an assessment on somebody and we see something that we are concerned about, we would recommend that they go and see a neurologist, get a formal EEG and go down that path. We would not engage with anybody who we were suspicious that there was some underlying epileptiform activity. And that's really important that we're looking for that. We're identifying that if we're suspicious, and making sure they get signposted in the right direction and get properly medically stabilized. And potentially, if that's the solution, that's fantastic. But the people who are on multiple medications still not got full stabilization, we can be an adjunct. But we would, that's a very, very clear area for us.
Yeah. The other area that we're happy to talk to people, but there are some categories, things like people suffering or in the category of substance abuse, addiction, anorexia, they really require what we describe as a multidisciplinary team, and they need wraparound support, and we will do everything to support someone in here, but they do need other individuals helping them at the same time. We have a fantastic colleague in the States who is the inventor of some of the stimulation equipment that we use in here. And he runs Florida House. Now, Florida House is a wraparound addiction clinic based in the States. And it has everybody there on site. And we just can't provide that here. So that is another clear area for us. So people who really require a team, we're happy to work in a team, but we're not the whole answer for some things. The other thing is we're often contacted by people in complete crisis. And we will always say they really need to talk to a crisis team before talking to us. We've just got to make sure they're safe. We do get calls from people who are very unsafe and they're in a very fragile position. So again, that's where talking and communicating with the NHS and the crisis teams is very important. It's important they go through that process, frustrating as it can be, I think.
Yeah, absolutely.
I think one of the other fundamental things is that we want people need to want to be here, and people need to hopefully engage with making some lifestyle changes if that's indicated. So, dietary sensitivities are a big area. So it may be that, making some adaptations. Now, we're not nutritionists, but we will signpost and say, right, there's a lot around. We've got healing and appropriate supplementation, appropriate testing, etc. More the functional medicine route. Because what we don't want to do is we don't want to waste people's time training in here if actually there is a root cause problem in their gut or their diet that's going to negatively, that's going to stop us achieving the gains that we can make. So we want a good outcome. So we're only going to work with people that we think that we're going to get a good outcome. And it may be they need to do other things before we engage with them. So, we're very clear. We don't take people on who we don't think we can help.
Yeah, and I'm thinking to maintain the gains as well, really, those lifestyle changes, if indicated, like you say, are going to be important because we know how much nutrition affects mood and that emotional regulation and exercise. It gets the good chemicals going in the brain, doesn't it? So tell us a bit more about then, what can people expect when they come into your office, from assessment through to treatment, through to monitoring progress?
We try and make the system as simple as possible, although our job is quite complex. It starts usually with someone contacting us through our contact page on our website, or giving us a ring and leaving a message. And we are very happy to talk to people. We usually put about 30 minutes in the diary to talk to people because we have to assess if we can help them as well. Okay. And after that chat, where we talk about lots of different things and how we might be able to help, they usually book in for a quantitative EEG assessment, and it takes a couple of hours. They get quite a detailed questionnaire and send it back. And then we spend a good couple of hours assessing that individual. We look at them electrically, but we also look at the challenges they're facing and talk about their history. So it's quite a detailed couple of hours. After that, we're really assessing what can we do to help this individual? How do we unstick this? And it can be a number of different techniques. It can be what we call neurofeedback in clinic, which is a feedback loop where essentially listening into someone's brain and trying to encourage it to work in a better way. We use light technology, which is phenomenal, which is called near-infrared technology for a brain. We also use some sound technology, which is digitally altered music, which can be incredibly effective as well. And we also use neurostimulation technology, and this is very much applicable for people who have depression, sometimes for the ADHD population, sometimes for anxiety. But all the time we're assessing what is the best package we can put together for this individual to shift them as quickly and as safely as we possibly can to help them. And once we put that package of things together, we're always assessing, we're always measuring, we're always looking to see if we're doing a good job. And we use electronic symptom trackers to do that. We will often put the EEG cap back on someone's head after a number of sessions just to see how their brain is doing. And we talk to people a lot. We also do what's called CPT testing. And CPT testing is looking to see how a brain is operating in low and high demand tasks. A very simple test, but very reproducible. So a lot of the things we do try and measure. At the end of a process, and we do encourage the process to end, often we see people who we become a safety blanket and we say, no, you're good. Come back and see us every month, every year, whatever it might be. And because we're about mobilizing that person. We're about changing how they're running, mobilizing them and getting back out there to have a content life. We talk a lot about contentment in here, Angeline. We had a lot of people expect to be happy all the time, and that is not reality. But contentment and resilience is there are keywords in here. So that is pretty much the process. We can get someone within a neurofeedback program in here within about and get them mobilized within a space of a few weeks. And with the sound system, that can happen within 10 days. So it is actually a relatively efficient process, and different for different challenges. When we see children with developmental delays, these could be children who were brain damaged at birth or have certain conditions, they are more long-term projects for us, and we have to really explain to the parents that this is the case. So we're very honest with people. But for a lot of people, we can help quite quickly.
Yeah. Again, the neurodegenerative conditions or we can make a definite improvement in the quality of life. But it does require ongoing interventions to maintain that, and there will come. So you can improve somebody's quality of life, but you have to keep doing the work, and there will come a point at which the neurodegeneration will exceed the capacity for the compensation. But you can keep somebody better for longer, keep their quality of life and for their families better for longer. But, we're very clear about those that we have a lot of things that we work with, we can make a big difference in 20 to 40 sessions. There are certain things that will be long term, and we're always very clear with people when we think that will be the case, because we don't want to promise something. We can't promise a miracle if that's not the reality. And we often don't know what, for children with significant neurodevelopmental disorders, we don't know what the long term, what can we achieve? How far can we go? And often if you get a child young, you might work with them for a while, you have rest, do some other interventions, and then come back to them later on. It can sometimes be a journey over many years, but not constantly. Sometimes using different interventions and different technologies can help the brain switch up, because the brain can become a bit lazy. So sometimes it needs a little kick up the boot to send it on its next trajectory. So we try to be honest with people, don't we?
Yeah. Everything we do has good research behind it. I think Mel and Jean mentioned before that people, when we first set up, thought we were, and colleagues at the hospital, etc., thought it was a bit weird science. it's not weird science. If you put into Google quantitative EEG, if you put into Google neurofeedback for depression or stimulation work for depression, there is a lot of research out there. And the slight issue that our practice has is the fact that it's not a drug. So drug companies have an awful lot of money to put into what they call double-blind trials, and it's very difficult for us to do that because we are dealing with someone's completely unique biology. And so it's very difficult to apply one technique to a population. But there is a lot of research out there. If you put Now everybody's talking about ChatGPT and the new what's it called? Deep something. If you put into any of those search engines what we do, there's a lot of data that comes up. So we're on the start of the new wave of thinking about how to help people with mental health and physical challenges change. And we're on the cusp of that journey, I think now. We're on the cusp of that wave.
I love that. I love what you were saying earlier as well, because there's a real holistic feeling to this where it's realistic, it's a contentment. Life is a mixture of challenges. So we have more stable times and more content times, but challenges are going to come. It's the nature of life. So I like the realistic aspect of this, where you're helping people to live their best lives, but within that, it's we need that resilience, don't we? The resilience for when those challenges come. So I really liked the way, and I liked it's kind of coming at it from both angles, from the physiology side, of looking at what's really going on in the brain, and then being able to adapt the treatment, taking into consideration the person's story as well and their lifestyle. So it's coming at it from two different angles there, really. It's giving you real insight into that person's well-being and what their struggles really are.
I think it's really important. We don't perceive ourselves to be delivering a treatment. We are training. Okay, we very much talk about training the brain. We are a gym for the brain. So we are not fixing your brain. We are enabling your brain. Okay, so I think we very much talk in those terms. This isn't a treatment. It's a brain training, and we are training your brain to better stability, to better levels of arousal. And if we train enough to get stabilization of that, then you should sustain it going forwards. But you have to do enough. You have to train to stabilization, and acknowledging that bumps will happen. Hopefully, you'll have more resilience. But if we train with somebody and we get a really good outcome, and then they go out and have a major head injury, then it's going to impact them. So we very much talk in terms of this is training. This is brain training.
That's it for part 2 in our 3-part series. Join us next week, where we continue this fascinating discussion on this amazing technology with the BrainCollective. Look forward to talking with you next week.